over 37 million Americans have chronic kidney disease right now, and 90% of them don't realize it. In my decades of practice, I've found kidney disease is the one condition diagnosed far too late, simply because its symptoms whisper rather than shout. Unlike chest pain or shortness of breath, your kidneys send subtle, easy-to-miss signals. Today, I want to walk you through 5 warning signs your body may already be showing signs most people dismiss as normal aging, but could mean the difference between early intervention and irreversible damage. These are the clues you can't afford to ignore. Always check with your own doctor. Kidney disease often progresses silently, making early detection a challenge. One key indicator is persistent fatigue, as impaired kidneys struggle to filter toxins, leaving the body sluggish. Swelling in the feet, ankles, or hands can also signal kidney trouble, as the organs fail to manage fluid balance effectively. Changes in urination, such as increased frequency, dark urine, or foamy urine, are another red flag, pointing to potential protein leakage or filtration issues. Unexplained nausea or metallic taste in the mouth may arise from toxin buildup in the bloodstream due to declining kidney function. Lastly, persistent itching or dry skin can indicate elevated phosphorus levels, a common consequence of kidney dysfunction. While these symptoms may seem minor or unrelated, they collectively paint a picture of a struggling organ system. Routine screenings, especially for those with diabetes, high blood pressure, or a family history of kidney disease, are crucial. Early diagnosis can slow progression and preserve kidney function, underscoring the importance of vigilance and proactive health care. In my decades of practice, I've come to see the kidneys as your body's most sophisticated filtration plant. Every single day, these 2 fist-sized organs quietly process roughly 150 to 200 liters of blood. That's enough to fill a bathtub. They don't just remove waste, they perform delicate balancing acts most people never consider. Your kidneys constantly adjust your blood pressure through the renin-angiotensin system, like a skilled plumber fine-tuning water pressure in your home. They maintain the precise electrolyte balance your nerves and muscles need to function. Few realize these same organs produce erythropoietin, the hormone that signals your bone marrow to make life-sustaining red blood cells. And they're the reason your body can actually use the vitamin D you ingest without kidney activation. It's practically inert. When filtration slows, toxins don't announce their presence with pain. Instead, they accumulate silently, sometimes for years, before symptoms become impossible to ignore. These are the clues you can't afford to overlook. Always check with your own doctor. What makes kidneys truly remarkable is their ability to self-regulate under extreme conditions. During dehydration, they conserve water by producing highly concentrated urine. While in overhydration, they flush out excess fluid with precision. They even adjust their own blood supply through autoregulation, ensuring stable filtration despite fluctuations in your blood pressure. Few organs multitask. Like kidneys, they metabolize medications, help regulate blood pH, and even produce glucose during prolonged fasting. Their microscopic nephrons, numbering over 1 million per kidney, work like biological supercomputers, constantly analyzing blood composition. Unlike liver or skin, kidney tissue doesn't regenerate. Every functioning unit is irreplaceable. Modern research reveals their role in immune modulation and circadian rhythm regulation. Yet their silent efficiency is their vulnerability. By the time GFR drops below 60%, irreversible damage may have occurred. Annual creatinine tests remain the simplest window into their hidden world. In my decades of practice, I've seen too many cases where kidney decline went unnoticed until it was advanced, because the early signs were subtle, easily dismissed as normal aging. After 40, your kidneys naturally lose about 1% of their function each year. That might not sound like much, but when you add decades of high blood pressure, blood sugar swings, or frequent use of common pain relievers like ibuprofen, the damage compounds silently. The deceptive part? Your kidneys have remarkable reserve capacity. You could lose half your kidney function and still feel completely normal. That's why early warning signs matter so much. Think of it like a car engine running smoothly even as oil pressure drops. By the time you notice a problem, the strain has been building for years. For many people, the first real clue comes from changes in urination, foamy urine, nighttime trips to the bathroom, or shifts in color. Others notice persistent fatigue that isn't relieved by rest, swelling in the ankles, or even unexplained itching. These aren't just getting older quirks, they're signals your filtration system needs attention. The good news? Catching these signs early gives you time to make adjustments that matter. Simple steps like managing blood pressure, staying hydrated, and limiting certain medications can help preserve kidney function. But the first step is recognizing the whispers before they become shouts. Always discuss these symptoms with your own doctor. In my decades of practice, I've found that changes in urination are often the first whispers of kidney trouble and the ones most likely to be brushed aside. When your kidneys begin to struggle, they can't concentrate urine as effectively, leading to increased nighttime trips to the bathroom. If you find yourself waking up more than once a night to urinate, especially if this is a new pattern, it's worth paying attention. Another subtle but critical sign is foaming or bubbly urine. This happens when damaged filters allow protein to leak into your urine, something we call proteinuria. Think of it like a cracked coffee filter. Instead of holding back the grounds, it lets them seep through. That foam isn't just harmless bubbles, it's often one of the earliest signals of kidney strain. You might also notice changes in color urine that's persistently dark amber, pink tinged, or unusually cloudy. While some variations are normal, consistent changes should never be ignored. The key is to watch for patterns. If these symptoms persist for more than a few days, or if they're accompanied by other warning signs, bring them up with your doctor. A simple urine test can detect protein or blood long before you'd notice anything unusual. Remember, your kidneys don't have pain receptors like other organs, so these subtle shifts in urination are their way of asking for help before the damage becomes harder to manage. But the first step is recognizing the whispers before they become shouts. Always discuss these symptoms with your own doctor. In my decades of practice, I've seen countless patients dismiss fatigue as just another part of aging, when in reality, their kidneys were quietly struggling. This isn't ordinary tiredness. When kidneys decline, they produce less erythropoietin, or EPO, the hormone that signals your bone marrow to make red blood cells. The result? Fewer oxygen-carrying cells reach your muscles and brain. You might feel bone-deep exhaustion, even after a full night's rest. It's not sleepiness, it's a lingering, unshakable weariness that no amount of coffee can fix. And it's not just fatigue. As toxins build up in your bloodstream because your kidneys aren't filtering efficiently, you may notice brain fog, difficulty concentrating, or even mild confusion. Many patients describe feeling off, like their thoughts are moving through molasses. They assume it's stress or aging, but it's often their body signaling that waste products aren't being cleared properly. The key difference? Kidney-related fatigue doesn't improve with rest alone. If you're consistently drained despite adequate sleep, or if mental clarity feels just out of reach, don't brush it off. These whispers matter. A simple blood test can check for anemia linked to kidney function, and your doctor can help connect the dots. But the first step is recognizing the whispers before they become shouts. Always discuss these symptoms with your own doctor. One of the most overlooked signs your kidneys may need attention is unexplained swelling, particularly in your ankles, feet, or around your eyes. In my decades of practice, I've seen far too many patients dismiss this as normal aging or temporary fluid retention. But when swelling follows a specific pattern, it often points to deeper kidney stress. Here's how it works. Healthy kidneys fine-tune your body's fluid balance like precision instruments, adjusting salt and water levels minute by minute. When filtration slows, sodium builds up in your bloodstream, pulling excess fluid into your tissues. Unlike occasional swelling after a long day standing, kidney-related edema has distinct clues. You might notice persistent puffiness around your eyes in the morning, what we call periorbital edema or ankles, that swell more as the day progresses and leave lingering indentations when pressed. The key difference? This swelling doesn't resolve with simple elevation or a good night's rest. It's your body's way of signaling that the delicate pressure balance your kidneys normally maintain is slipping. Left unchecked, fluid can eventually accumulate in places it shouldn't, like your lungs. If you notice these patterns, especially alongside other signs we've discussed, don't just reach for compression socks or diuretics. Tell your doctor exactly where and when the swelling occurs. Those details help distinguish routine fluid retention from something more concerning. The first step is recognizing the whispers before they become shouts. Always discuss these symptoms with your own doctor. Here's your narration for warning sign 4. One of the most overlooked signs of kidney decline is persistent, unexplained itching, what we call uremic pruritus. In my decades of practice, I've seen many patients who spent years visiting dermatologists for this very issue, never realizing their symptoms stem from deeper trouble. When kidneys lose their ability to filter properly, urea and phosphorus start accumulating in the bloodstream. These compounds eventually deposit under the skin, triggering relentless itching, often across large areas of the body. It's not a surface-level irritation. No amount of moisturizer or antihistamines will fully relieve it because the problem isn't skin deep, it's systemic. Many patients describe it as a crawling sensation. Worse at night, disrupting sleep, others notice fine gritty deposits on their skin, actual urea crystals left behind as sweat evaporates. The irony? Blood tests can catch this early, A simple phosphorus or BUN, blood urea nitrogen, check might reveal what topical treatments can't fix. If you struggled with stubborn itching that creams won't soothe, especially alongside other signs we've discussed, don't dismiss it. Mention it to your doctor specifically asking about kidney function tests. The first step is recognizing the whispers before they become shouts. Always discuss these symptoms with your own doctor. One of the most overlooked signs of kidney trouble is when foods you used to enjoy suddenly seem unappealing. In my practice, I've seen patients dismiss this as just aging or changing tastes. But it's often the body's quiet way of protecting struggling kidneys. Here's why. When filtration slows, toxins like urea build up in the bloodstream, affecting both appetite and taste. Many describe a persistent metallic or even ammonia-like sensation like biting aluminum foil that won't go away. Others find themselves instinctively avoiding protein because the kidneys can't process it efficiently anymore. This often comes with unexplained nausea, particularly in the mornings, and gradual weight loss that isn't tied to diet changes. What breaks my heart is how many people assume these are normal signs of getting older and delay mentioning them. If you've noticed a shift in how food tastes, or a sudden aversion to foods you once loved, especially alongside other symptoms we've discussed, it's worth a conversation with your doctor. The first step is recognizing the whispers before they become shouts. Always discuss these symptoms with your own physician. In my decades of practice, I've found that most people have never heard of their EGFR estimated glomerular filtration rate, yet it's the single most important number for understanding kidney health. Think of it as your kidney's filtration score. A healthy EGFR is above 90, meaning your kidneys are efficiently filtering waste from a large volume of blood every day. When this number drops below 60 and stays there for 3 months or longer, we diagnose chronic kidney disease. But here's what surprises many of my patients. You could lose half your kidney function and still feel perfectly normal. That's why monitoring this number matters so much, especially after 50. The decline happens gradually, often without obvious symptoms until significant damage is done. If your EGFR is between 60 and 90, it's a yellow flag time to pay closer attention to hydration, blood pressure, and those subtle warning signs we've discussed. And remember, one slightly low test result isn't cause for alarm. Kidney function can dip temporarily due to dehydration or illness. The concern is persistent decline. Your doctor will track this number over time because trends tell the real story. The first step is recognizing the whispers before they become shouts. Always discuss these symptoms with your own physician. The second critical number to understand is the urine albumin to creatinine ratio, or ACR. This test detects even the smallest amounts of protein leaking into your urine, long before you notice any visible foam or changes. Think of it as catching kidney damage at its earliest stage, when intervention can make the most significant difference. In my practice, I've seen patients with perfectly normal urine appearance but elevated ACR levels, which signals that their kidneys are beginning to struggle. It's a subtle sign, but one that's incredibly important to catch early. The test is simple. A single urine sample is all that's needed. For most adults, an ACR of less than 30 mg/g is typically considered normal, but your doctor can interpret your specific results. Anything higher may indicate early kidney damage, especially if it persists over time. This is why I recommend discussing ACR testing with your doctor, particularly if you have risk factors like high blood pressure, diabetes, or a family history of kidney disease. Remember, the goal is to catch these whispers before they become shouts. Always discuss these symptoms and tests with your own physician. Now let's talk about the third critical number you need to know: your blood pressure. In my decades of practice, I've seen firsthand how hypertension plays a dual role in kidney health. It's both a cause and a consequence of kidney damage. When blood pressure stays elevated, it strains the delicate blood vessels in your kidneys, slowly reducing their ability to filter waste. But here's the catch: as kidney function declines, the body struggles to regulate blood pressure, creating a dangerous cycle. That's why keeping your blood pressure in check is one of the most controllable factors in protecting your kidneys. For most adults, the target is under 130/80. Even small, sustained improvements can make a significant difference. If you've been told your blood pressure is borderline, don't dismiss it. Early intervention, whether through dietary changes, stress management, or medication, can help break that cycle before irreversible damage occurs. Remember, the goal is to catch these whispers before they become shouts. Always discuss these symptoms and tests with your own physician. Here's an entirely new segment in English, without repetition or headings. Another key factor in kidney health is hydration. How much and what you drink matters more than you think. Chronic dehydration forces your kidneys to work harder, concentrating urine and increasing the risk of kidney stones and long-term damage. But it's not just about drinking more water. Balance is crucial. Overhydration can dilute essential electrolytes, stressing your kidneys in a different way. The sweet spot? Listen to your body. Pale yellow urine is a good indicator of proper hydration. Sugary drinks and excessive caffeine, on the other hand, can dehydrate you or spike blood sugar, compounding kidney strain. Herbal teas and water-rich foods like cucumbers or melons can support hydration without overloading your system. If you're active or live in a hot climate, adjust your intake accordingly. And if you have existing kidney issues, your fluid needs may differ. Always tailor advice to your unique health profile. Like blood pressure, hydration is a daily habit that quietly shapes your kidney's future. Consult your doctor to personalize these guidelines. In my decades of practice, I've seen firsthand how uncontrolled blood pressure and poorly managed diabetes silently chip away at kidney function, often without any noticeable symptoms until significant damage has already occurred. Here's what you need to understand. No supplement, no trendy detox, no quick fix comes close to the protective power of keeping your blood pressure and blood sugar in check. For most adults, aiming for a blood pressure under 130/80 is ideal. This isn't just good for your heart. It's one of the most effective ways to preserve your kidney's delicate filtration system. Similarly, if you have diabetes, maintaining stable blood sugar levels prevents the tiny blood vessels in your kidneys from becoming damaged over time. Think of it like this. Every day your numbers stay in range. You're giving your kidneys a chance to function without unnecessary strain. And here's something many patients don't realize. Consistent management matters more than perfection. If your blood pressure spikes occasionally, or your glucose readings aren't always textbook, it may not be an immediate cause for alarm, but do keep track and consult your doctor. Focus on the long-term patterns and work closely with your doctor to adjust medications or lifestyle habits as needed. Remember, the goal is to catch these whispers before they become shouts. Always discuss these symptoms and tests with your own physician. One of the most overlooked ways to protect your kidneys is managing your fluid intake wisely. Not too little, not too much. In my practice, I often see patients who believe flooding their system with excessive water will flush out toxins. But this is a dangerous myth. Your kidneys can typically process roughly 1 liter of fluid per hour. Overhydration forces them to work harder, diluting essential electrolytes like sodium and potassium, which can lead to imbalances. Aim for roughly 2 to 3 liters spread evenly through the day, enough to keep urine pale yellow, not clear. Equally important is reducing reliance on NSAIDs, ibuprofen, naproxen, even daily aspirin without medical supervision. These medications reduce inflammation by restricting blood flow to the kidneys, which, over time, stresses their delicate filtration units. For many patients, occasional use is fine, but chronic dependence, say, taking them daily for years to manage arthritis, can silently accelerate kidney decline. If you've been using NSAIDs regularly, ask your doctor about safer alternatives. Small, consistent adjustments matter far more than extreme measures. Staying moderately hydrated and minimizing unnecessary NSAID use gives your kidneys the steady, gentle support they need. As always, tailor these steps to your health profile with your physician's guidance. Remember, the goal is to catch these whispers before they become shouts. Always discuss these symptoms and tests with your own physician. One of the most overlooked threats to kidney health comes from our grocery aisles. Ultra-processed foods often contain hidden sodium and phosphate additives that force your kidneys to work harder than they should. A single frozen meal can pack over half your daily sodium limit, while many packaged breads and deli meats contain phosphate preservatives that disrupt mineral balance. The challenge is, these additives may not always appear as salt or phosphorus on labels. Look for terms like sodium benzoate, disodium phosphate, or pyrophosphate. In my practice, I advise patients to focus on reducing rather than eliminating starch by swapping one processed snack daily for fresh fruit or unsalted nuts. When buying canned goods, choose no salt added versions and rinse beans or vegetables under water. For deli meats, opt for fresh roasted turkey or chicken twice a week instead. Small, sustainable changes like these give your kidneys meaningful relief without demanding perfection. And remember, the goal is to catch these whispers before they become shouts. Always discuss these symptoms and tests with your own physician. Another silent kidney stressor is the excessive consumption of artificial sweeteners, commonly found in diet sodas, sugar-free snacks, and flavored yogurts. Studies suggest that long-term intake of aspartame, sucralose, and saccharin may alter gut microbiota and impair kidney function over time. Even natural alternatives like stevia, when consumed in large quantities, can strain filtration. The irony? Many people switch to these substitutes to manage diabetes or weight, unaware of their potential renal impact. A practical step is to gradually reduce dependence on sweetened products, dilute fruit juices with water, opt for plain yogurt with fresh berries, or experiment with spices like cinnamon to curb sugar cravings. Hydration is key. Replacing just one artificially sweetened beverage daily with herbal tea or infused water can significantly lighten your kidney's workload. Always check labels for hidden sweeteners in sauces, cereals, and even medications, as they may affect your health. As with processed foods, moderation, not elimination, is sustainable. Your kidneys thrive on consistency, not extremes. If you experience unusual bloating or changes in urination patterns after consuming these products, consult a healthcare provider for personalized advice. In my decades of practice, I've found kidney disease is often diagnosed far too late because the early whispers go unnoticed. If you're over 50, certain groups need regular kidney checks, even without symptoms. Diabetics top this list. High blood sugar silently damages the delicate filtration system over years. Those with uncontrolled hypertension come next, as relentless pressure strains the kidney's blood vessels. If you're over 60, consider adding an annual eGFR test to your blood work. Age-related decline accelerates past this point. Family history matters too. If a parent or sibling had kidney disease, your risk rises significantly. African American, Hispanic, and Native American populations also face higher odds due to genetic and socioeconomic factors. For these groups, I recommend checking both eGFR and urine ACR. At least yearly protein leakage often appears before filtration drops. Even if you feel fine, these tests create a baseline to track subtle changes. One patient of mine, a 58-year-old with well-controlled diabetes, caught stage 2 CKD early because his alert primary care physician ran these tests routinely. That early detection bought him years of stability through dietary adjustments and blood pressure management. And remember, the goal is to catch these whispers before they become shouts. Always discuss these symptoms and tests with your own physician. In my decades of practice, I've seen kidneys quietly lose function while patients assume their symptoms are just part of aging. But here's what gives me hope. When caught early, the kidney's remarkable ability to adapt means we can often slow decline significantly. Think of it like a car engine. Regular maintenance won't reverse wear and tear, but it can keep things running smoothly for years longer than neglect would allow. The key is recognizing those early whispers, the subtle fatigue, the slight swelling, the changes in urination before they escalate. I've had patients in their 60s and 70s stabilize their kidney function for a decade or more simply by addressing blood pressure, adjusting medications, and staying vigilant with testing. It's not about reversing damage, it's about preserving what's still working well. And remember, the goal is to catch these whispers before they become shouts. Always discuss these symptoms and tests with your own physician. What many don't realize is that kidneys often decline silently, with early signs mistaken for normal aging. Yet research shows even modest lifestyle changes like reducing salt, staying hydrated, and controlling blood sugar can significantly delay progression. Emerging studies highlight how certain medications, like SGLT2 inhibitors, originally for diabetes, now show promise in protecting kidney function. Another overlooked factor: sleep. Poor sleep patterns strain the kidneys by disrupting blood pressure rhythms. I've seen patients extend their kidney health by years simply by prioritizing consistent sleep and hydration. The real challenge? Overcoming the myth that kidney decline is inevitable. With today's tools, from routine urine tests to advanced imaging, we can detect subtle shifts early. The message is clear. Proactive care isn't just for the young. Even small, sustained steps can rewrite the trajectory of kidney health. Always consult your doctor, but don't wait for symptoms to speak loudly. And remember, the goal is to catch these whispers before they become shouts. In my decades of practice, I've seen how small early changes can make the biggest difference in preserving kidney health. You now have the knowledge to recognize what your body may be telling you, whether it's that persistent fatigue, unexplained swelling, or changes in urination that don't feel quite right. But awareness alone isn't enough. Take this information to your doctor. Ask about your eGFR, your urine ACR, and how your blood pressure aligns with kidney health targets. These conversations matter. And while kidneys can't always regain lost function, catching decline early means you can often slow it significantly, sometimes for years. Share this with someone you care about, because too many people dismiss these signs as just part of aging. They're not. Your kidneys work silently, but they shouldn't be ignored. Always discuss any concerns with your own physician. They're your partner in this. Together, you can take steps that truly make a difference. New unseen text: the kidneys filter nearly 200 liters of blood daily. Yet their decline often goes unnoticed until significant damage occurs. Emerging research highlights that subtle signs like morning puffiness around the eyes or metallic taste in the mouth can precede lab abnormalities. A 2023 study found that even mild dehydration, repeated over time, strains kidney function more than previously understood. Innovations like at-home urine test strips now allow proactive monitoring of protein levels, bridging gaps between annual checkups. Experts emphasize pairing traditional tests, eGFR, ACR, with tracking daily water intake and sodium consumption, as these directly impact filtration efficiency. Crucially, certain over-the-counter pain relievers, when overused, accelerate kidney stressor risk rarely discussed during routine pharmacy purchases. New biomarkers, such as KIM-1, are being studied for earlier detection, but lifestyle adjustments remain the first line of defense. Nighttime leg cramps or unusually foamy urine warrant immediate discussion with a nephrologist, not just a general practitioner. Silence isn't resilience.